Welcome back to Daybreaking. It's now some 28 minutes to 7 o'clock, and it's time we want to take some focus on the COVID-19 pandemic. We're expecting to be joined by Dr. Evans Camuri, but joining us this morning is Dr. Victor Ngani, who is a critical care doctor. And I want us to begin by taking a look at some situation of where we are as a country. Of course, so far reporting what you'll see on the screen there as 32,557 infections. Is it? Yes, 557 infections so far reported. But if you look at the curve that is on your screen, this is part of what has been the conversation from the Ministry of Health as well as the medical professionals, that you see the caseload starting to decline, but also informed by the number of tests that are being conducted. You see that on the week that concluded on Sunday 23rd, that number declined to 2,244 infections. That takes us back almost to in between week 16 and 17 of this pandemic. And of course, now that forms the basis of our conversation here. Dr. Ngani, I want to begin with you. As you monitor this trend, of course, also Dr. Evans Camuri, the CEO of Kenyatta National Hospital, is now with us. As you look at the trend, we hear the Minister of Health saying that we might be approaching the peak because the positivity ratio is declining to 5-point-something%. Are you convinced that this depicts the right or the correct picture on the ground based on the fact that the testing is sort of reducing?
Well, the Ministry of Health, I think Kenya has been quite open about its COVID situation and numbers. And recently, you had the CAS Health report that they were estimating about 3 million positive cases in the country as of, I think, sometime last week. And this is a very unusual step. Most countries want to sort of play down their COVID-19 numbers. Mm-hmm. And so when the ministry gives such a statement, it sort of gives us hope that the figures are fairly correct. However, it would then not be correct to feel that we're heading towards the peak, because at just about 3 million, there's still quite a number of people could be infected. Currently, the estimation is that for every one patient who's infected, they could infect up to 3 people. And so if last week we had about 3 million cases, then you can imagine that in the next couple of weeks, we can see exponential spread. So I would imagine that if the previous numbers given are right, then you could be seeing a peak in the next few weeks as opposed to now. And also, those numbers shouldn't be read in isolation. We have to look at the number of tests being done. Mm-hmm. I think at some peak, we've tested about 40-something thousand patients, and now that number has gone down a little bit, and therefore you expect to have fewer numbers. Granted, the MOH is talking about positivity rate, which means that regardless of the number that you've tested, you'll see a smaller proportion. The other factors that come into play, because initially we were testing contacts. I think contact tracing has gone down significantly, and we were testing high-risk groups and populations. Now, as you spread the testing to the wider population, where you're picking people off the street in different areas where COVID has not spread, outside of Nairobi, which has been a hotspot, then you are likely to see a decline in positivity rate. The other issue that is possible is people are taking measures now to stop themselves from contracting COVID, and therefore the rate of infection could be dropping, but it doesn't mean that this is going to burn out anytime soon.
And Dr. Camuri, when the Minister of Health says that they're using the percentage of 7.6% to extrapolate out of the global population of 47 million in Kenya, is that a correct extrapolation? Because it is mathematical, yes, but is it scientific when it comes to how pandemics or such infectious diseases spread?
Thank you very much, and good morning. Well, one thing as my brother has said there is that the ministry has been very open about COVID. And unlike other countries who would want to hide the truth and the facts about COVID, we have been, as a ministry, we have really been accurate and putting facts as they are. And as he has said, the positivity rate, who are the people we are testing and are positive? What does that mean? What it means is that among the people you will test, how many become positive? And that's one thing that we are happy about. The fact that we are not seeing as many as they were does not mean actually that we have flattened the curve. Mm-hmm. What have we done? What we have done is that people have gotten the measure. And as Senator Mutahi Kagwe has been saying daily, what we need is to have Kenyans adhering to the measures so that this thing does not treat us normally, the way it would want, or abnormally, the way we do. And what has happened now is that people have gotten more measures. People have now started adhering to what we have been preaching and what Waziri has been saying on a daily basis. And this might actually be what has really saved this nation. And more so, if you look at now the measures even the county have put in place. This fight you have been saying, oh, we don't have bed, oh, we have. Right now as we speak, most of the counties now are ready for the management of the COVID. And this by itself, without actually extrapolating or looking at the curve, shows that as a nation, we are now going towards the right direction. That does not mean we are flattening the curve. It is very important for us to know that this is even the time we even need to put even more stringent measures. And if you remember what Waziri said, if he had not done the measures we had put, the positivity rates would still be doing those ones of 20 or close to 20%.
Right.
But now, what has improved us for now is the people we are testing who are becoming positive. It means now Kenyans have woken up. Kenyans have learned that this thing is not sparing anybody. This thing needs only the measures we put. And with that, I can assure you, my brother, although we are not yet at the peak, we will not follow the curve which the scientists had actually anticipated. You know, and you remember what we said earlier, me and you again. The curves are normally done by a situation called modeling.
Right.
Modeling means that if you did not put the measures we put in place, what would happen? For example, if you don't put a brake to your vehicle and you are running high speed, when you get to a slope, what is likely to happen? When you get to a bend, what is likely to happen? So we put these measures so that actually we don't follow the model. And
All
now
right.
at the rate we are using now, the 7, 9 to 10%, we are now extrapolating again. If we were to follow that model, what would happen? And this is a good sign. And I think as Kenyans, we should be proud of the way the Ministry of Health has held and the way the nation, all stakeholders have really participated in combating this COVID business.
Dr. Camuri, you raise an important question about the counties, and you're saying that now they are prepared, they have the beds and what have you. But there's a report that came out last week from the Nyeri County Assembly, and it indicates that Nyeri County has no functional ventilator, for instance. They have no capacity to deal with severely affected patients or severe disease among patients. How then would you say that they are well prepared? Yes, they have the beds, but when it comes to the critical care, which the 7% that are symptomatic would require, it's not yet at the right place.
Well, one thing I would want to tell to say to you, when we talk about preparedness is not just having enough beds, having enough ventilators. Those are physical. There are many, like now we have been going, there is a task force that was appointed by the ministry to go around and see what has the county done and also supervise and tell them and advise them what needs to be done. And when we talk about preparedness, it does not mean that now we have enough ventilators. It doesn't mean that now we have enough beds. All what we are saying is that there are several types of preparations. One, psychologically. Two, in terms of infection prevention and control, what we call the IPC measures. Three, in terms of standards. Four, in terms of beds. Five, in terms of now those high-profile equipment. And one thing I want to tell you also, COVID preparation is not just ventilators. Ventilators is actually at the end of the road. So what we have been trying as a ministry is to make sure, can we prepare counties in a way that we'll avoid getting to a point where the counties get to use ventilators. So, but you see, some political figures only look at preparation as in how many ventilators, how many beds do you have. There are many ways, my brother, to
well,
say...
Well, Dr. Camuri, you said the politicians, but I'm talking about the County Assembly of Nyeri, which toured all the hospitals in that area, and part of the other findings they got is that the healthcare workers are lacking the protective, or rather the PPEs. But all the same, Dr. Victor Ngani, you are a critical care doctor, and Dr. Camuri there says that yes, you may do all the preparations, but preparation is not just about the ventilators. But I'm looking at the numbers the past 3 weeks. If you look at the death toll of the week that concluded on Sunday, 74 people lost their lives to COVID-19. The previous week it was at 54. The other week it was at 51. So we had actually gone on a decline. Now we are on the rise. What do you think is happening, and what do you require to be in a position to save as many patients that get to the critical stage as possible?
Thank you. But you see, the numbers you're seeing, the kind of path that you're seeing in terms of COVID-19, unfortunately, this is what you'd see in terms of trend, because as more people get infected, then you expect at some point there'll be significant deaths in that space. Remember that we are not testing all patients who have COVID-19. We are not testing nearly enough. This is why you know the number of cases reported as positive is one number, and what the ministry is projecting is another number. And the most significant thing is not actually what happens in the hospitals, it's what happens in society. And you said very correctly, the number of patients who develop symptoms or severe symptoms is just about 7% of the proportion, 7%. And these are people with hypertension, with diabetes, with chronic illnesses, with cancer, any reason to have decreased immunity, people who are above the age of 65 years old. And this population, when they get COVID-19, it's not a joking matter. They get very sick, they get into ICU, they require extreme care. And so what we must do as a society is protect these individuals. And how do we do this? The message has been out there and it's very clear, and I'm hoping we are beginning to align ourselves to that message, which is don't visit your parents at this time. You show your care now by staying away. Those who have chronic illnesses need an extra level of protection beyond what everybody else is doing. We are seeing you use the standard measures, hand hygiene, social distancing, masks in public spaces, and masks in particular, special masks that can protect the individual for those who have chronic illnesses. That's the first thing. The second issue comes down to now what happens in the facility. And I'm glad the CEO has mentioned correctly that it's not just about having the beds. The beds must be functional. And unfortunately, as a country, we haven't invested adequately in healthcare. For the longest time, I think Kenyatta National Hospital has been the principal ICU for in the public sector that works, because it's not just about having the ventilators and the beds. You must have human resource that's capable, and it's not overnight that you acquire competence in this area. This is something that you have to deliberately train staff. It takes a bit of time to get them to a place where they can manage the ventilators. A ventilator in itself is as dangerous as it's helpful. So if you put a patient on a ventilator by a healthcare person who's not well trained in that area, then there are certain risks that you embrace. And so it's one thing to say we have beds, it's another that we have functional beds. Then of course, providing protective equipment to give the healthcare workers confidence that they are protected and safe, in addition to the training that must be given, infection control measures that must be put in place. And it's a whole system that needs improvement.
Right, and Dr. Camuri, there's this question about the first case of reinfection happening in Hong Kong. Of course, that patient is said to have traveled to Spain and now back, and it's just been 4.5 months in between the two diagnoses, if you may call them so. Have we done sufficient research to tell whether people that have gotten infected stand no chance or limited chance of reinfection? What do we know now?
Well, it's unfortunate that, this virus, and we have been saying, this virus change. We actually don't know. Today it will come in a suit, tomorrow it will wear casual, and maybe the third day it will come in a tracksuit. But what we know for sure, at the moment, there are people who are actually developing antibodies against the same, and they stand protected. However, the unfortunate bit is that this protection is not lifelong, and the literature as per now, majority of the people, by the time they do 3 towards 4 months, the protection wanes off, and now you can get reinfected. And as we have heard, even globally, even in Wuhan, a number of people actually got reinfected. We are still doing that study at the moment to see how many even Kenyans have developed the antibodies. However, as Dr. has said, What is more important is actually whether we can get, not whether we can get reinfected or not. What is more important is, can we shield, and I repeat, can we shield the people who are actually more prone to this disease? And how do we shield them? As you have said, the first thing, you always imagine you are a carrier. You always imagine you have COVID. So that, how do you protect the other person who is coming? How do you protect your mother in the village? How do you protect your father, your relatives, your elderly people in the village, and your friends? And that's the only way. And you know, most of the time, why now you are seeing some people now in the counties getting it is because those people who are in the village, most of them, a number of them, have the diabetes. They have other chronic illness, other debilitating challenges. And some of these things now, when you go to them to visit, we know we love them, but you know, sometimes we love them so much that we are actually taking the disease. And then two, it's not an issue of having a mask, it's an issue of wearing the mask appropriately. I get so, like now I will tell you, my brother, when I visit this hospital, I am actually sending some people out of the hospital. I tell them either, please wear the mask properly or go out. Go out and go and spread your COVID out there. Because actually, some people are just joking. You will see somebody wearing a mask down here or just covering the mouth. It means you are only wearing the mask to abide to the law, but actually you are not doing what we are supposed to do. What Dr. has said, unless we do those things, unless we social distance, unless we wear a mask appropriately, we sanitize and observe the infection prevention and control measures, we are still not doing what is right.
All right, very interesting there. And Dr. Ngani, so yes, as we look at this first case that has been confirmed of reinfection, of course, Dr. Camuri says there has been several in Wuhan, but how does it complicate our research as we continue in search for vaccines, in search for what people are calling the plasma sort of treatment? How does that spell out the next phase of research?
Well, the most significant setback is on what is called herd immunity. And right now, we are hoping that as many people contract the virus, they become immune, meaning that, let's say, for example, 70% of Kenya had gotten COVID-19, then even if there were COVID in that setting, it can't spread to somebody else. And it has nowhere to go, basically, because it's infected everybody. And this is actually the salient hope that we have. What the CEO is talking about has is actually leading to it, where we talk about people having antibodies to this virus. The second component about antibodies is there are vaccines now that are being created across the world. You heard of Sputnik 5 made in Russia and a couple of others. And the concept is they'll inject something into the body to create antibodies that can then fight the infection. But here's the problem. If there's reinfection, it means that these antibodies are not lifelong and they don't protect you for a very long time. And that means that after a couple of months, you could actually get back to that space where COVID reinfects you. And that makes it sort of an endless kind of a problem that requires a different solution other than antibodies. Now, we hope that this is an outlier, or that we'll find scientifically is probably a different mutation of the organism that makes reinfection possible, or that the individual has a unique risk. You know, hopefully that's what we'll find. There's still a lot of research going on, a lot we don't know about COVID-19, because if it turns out that reinfection is possible, then we do have a significant problem in this space.
Right, and Dr. Camuri, there are those that argue that by the fact that 93% of infections in Kenya are symptomatic, and out of that, so far, the recovery rate is at 60%. There are still those that are still nursing the infection, and the death toll is less than 1.7%. There are those that argue that it's not necessary to have a vaccine. What do you think?
You see, as in science, for us, one life, I'll tell you, is very important. One life of a person is significant. And other than the person who are reading there, they just take as statistics. For us who are in the health profession, a life is a life, one for one. And that's why even if we are to do, to give those vaccines and we save that one person, for us, and even for a nation, even if you heard what the president said, even one person as far as Kenya is concerned is significant. So whatever measure we may need to do, if we get a vaccine that will save that one person, it is prudent. The other thing we know is that, the people who are prone now, those people who are prone are actually the ones we are also worried more. although the people who are healthy and they will get the virus and they exit from it, how about these people who are actually people who are diabetic, hypertensive, cancer, and such? These are the people as a nation we need to protect. And one life is so important to this country. And I'll tell you, my brother, when you get involved, you personally, is when you actually get the weight. Otherwise, when you are reading in the news that we have 2,000 cases, for you and me is just statistics. But true to the matter, when it is you as a person, you will know that one out of the 2,000 is very significant. And that's why as a nation, let's handle each person's life variable.
Right, and let's talk about the fate of your colleagues in the profession, because there's been complaints in different counties, both at the subnational level as well as the national level. Some saying that the sort of PPEs they're receiving are poor quality. Actually, there's a strike in Nairobi because of that. There is a health worker yesterday who was quoted as saying that they've been receiving one mask to use for 14 days. Dr. Ngani, would you know what the real situation is, not just at the national level, but even down in the sub-counties?
Well, I wouldn't be in a position to speak much about that because I would have to be in that space to know exactly what's going on. However, I think it's clear that the level of support the healthcare workers have gotten across the country may not be optimal. I think there are shortages across board where we have maybe a few items that are needed that are not there. I think there are also documented episodes where whatever has been supplied seems not to have met the standard that is required across facilities. I haven't interacted with this personally, but then this is something that has been reported and shared, I think, publicly on social media, is in the public space. And so there's a big issue there that needs to be addressed with urgency to ensure that there is a service. Of course, at the same sitting, I would actually say something I've said publicly on social media as well, that I do not fully agree with withdrawing any kind of service at this time because the lives of our colleagues are at stake. I think the lives of healthcare workers is paramount and safety comes first. I think that's not negotiable. And so whichever teams need to sit down and have a discussion around this to make sure that services are running should do so with urgency. And if it's a matter of PPE that is missing to avail those, it's not proper that we are looking at some of the reports we've seen on the media about PPEs being real at the same time healthcare workers are lacking PPE. I also wanted to speak very briefly about the matter that we were discussing around
vaccine.
The
vaccine?
Yes, around vaccination, just generally the direction. There's a particular kind of a test that is positive now. You see, right now, if you do a COVID test, what you're doing is called PCR testing. And PCR testing, if it turns positive, it means you have the virus. Now, they're not testing everybody. So a lot of people actually suffering from COVID, and then that phase passes without them ever knowing they had COVID because they never got tested. Right. And Kenyans, when you say 93% are asymptomatic, it's not entirely asymptomatic. They're mildly symptomatic. And, for us, a cough here, a malaise, those are things that we sort of take in stride and don't even consider ourselves to be unwell. And so a lot of us actually go through that COVID situation and never get tested. But there is a test now that is should be rolled out. It's the antibody test. And that tells you that you've ever been exposed. And in this situation, you actually are hoping to get a positive test because it tells you, yes, you have had your contact with COVID, and now you're in that space where you're getting slightly better. And also what the CEO reported, it's not just one life. When you talk about 7% getting severe disease or getting into critical care, this means that we're talking about over 3 million Kenyans who are at risk of getting severe disease and possibly death. Now, that's a number that vaccines, have to be considered. That's a huge number of people, and really looking at it in that scale gives us, the sense that we perhaps need to do everything we can, get the vaccines in place, continue our measures, and just get everybody as safe as possible.
Okay, interesting. And see, you are here, you cough. I hope you're still all right. But you're the Chief Executive Officer of the Kenyatta National Hospital, and of course, you deal with healthcare workers there. How are you treating them in as far as the protective equipment that they receive? I know the demand is so high, they are expensive, but how are you treating them? Is it a similar case of what you're hearing, that one mask for 14 days?
Well, I'll tell you no. For me now, I can give you my space that in my hospital, as we have no problem, it is good to bear in mind that we started, it is Kenyatta National Hospital started with case number 1 from day 0. So these challenges, the more you get these challenges, the more you learn how to go about them. And at the moment, I said earlier, the challenge that we have in managing COVID is managing two things: the stigma and the fear from the health workers. The level of anxiety gets so high that if you is the first time you are getting the first case in whichever county, everybody is at helter-skelter. We moved out of there in March. Those were the problems that were making me not to sleep. Or the patient had come, at some point a patient would come and nobody is willing to see the patient because of that fear. People had not learned even how to use this PPE, leave alone saying this is the appropriate PPE and not. However, these are milestones. People grow and people come to learn how to do things. At the moment, we are now getting PPEs. And again, I thank the Ministry of Health. The Ministry of Health has been very, very pertinent and very instrumental in supplying of these PPEs. And this is the thing I would also want to tell the county. Let people go to the drawing board, because at some point, you must mix the technocrats and the politicians, the people who have the budget and the people who know what needs to be done. They must have a meeting together. They must look at their need. What does my county of Nakuru, for example, what does my county of Kirinyaga, for example, need in terms of PPE? And what type of PPEs is it we are talking about? Everybody, when we talk about PPE, my brother, even a mask is a PPE. The coverall is a PPE. The head is a PPE. We need those teams sitting together and prioritize. And then there is what we call the rational use, because these things are not cheap. I will tell you, an N95, even now when the market looks like it's flooded, it is still more than 1,000. So if you look at the cost implications, people must go to the medical dynamics and medical economics. And you must now start discussing about the rational use. For example, it's not everybody who needs an N95 unless you are in a hot area. Even in my hospital now, we have done protocols, we have done guidelines, and we are even distributing masks, and not just to patients, well, not just to staffs. We are even giving, if a patient comes without a mask, we actually give, so that we actually protect you and protect the worker.
The others.
This is the election that people need to discuss. These are practices that people need to engage. It's not an issue of throwing words, and also going out of work. And I say here without fear of contradiction, going out of work because a problem has not been solved and putting your tools down is not the way to go at this moment in time.
All right, and Dr. I just have one more question to conclude the conversation. But before I do so, I want us to take a look at some breaking news this morning that former MP of Likoni, Masood Mohima, has died. He is said to have succumbed to asthma complications at his home in Viamani, Mombasa County, of course, in Likoni. And he died at the age of 78. What we know is that he had been taken to hospital on Sunday, but he had been found to be okay. But last night, that is when he is said to have succumbed to those complications related to asthma. Once again, Masood Mohima, the former member of parliament of Likoni constituency in Mombasa County, has died at the age of 78. That's according to the family that is reporting. And we pass our condolences to the family at this difficult moment. But Dr. Ngani, just to conclude, so now you hear Dr. Camuri saying that Kenyatta National Hospital and the hospitals in Nairobi, most of them were able to deal with the pandemic, the fear, the stigma way in March. But now the other counties, especially if you're to get out of Mombasa, Nairobi and Kiambu, you'll see that the rest of the counties that this is when they're starting to interact with the disease. What do we do in the next weeks and months to ensure that we're able to get the hold of the real situation of COVID-19 in the regions, especially knowing that testing has been a challenge, including Nyeri County that has to wait until 7 days for patients to receive their results?
Yes, so the first thing is for the other counties to learn from the counties that have been before. And a lot of the times what we do as human beings in general, not just the counties, is that we don't realize that our turn is coming. And so we get a couple of months to prepare, but you don't do actual preparation. You do paper preparation, sort of media preparation. But in fact, the actual preparation should be there and put in place the setup that can actually deal with COVID. Look at the protocols, do the training, create staff capacity, stock up on PPE, and get adequate items, learning from the lessons from the countries that are going before you. A big component of all this is stigma. and that fear that comes with COVID-19, because a lot of people in spaces where they've interacted with it still feel that perhaps this is something to run away from. But you'll notice that in Nairobi now, most healthcare workers actually have more or less come to terms with this matter as a possibility, and they put on their PPE, say their prayers, and continue their work, because this is not something that's going away. And at the end of the day, we have to serve our brothers and sisters. And this is the attitude you find in many hospitals right now. Of course, I also have to mention that as a country, we have to be strategic in our approach. We have no business buying PPE. The example of K95 for more than 200 shillings now. There are factories in China that are making this for $1. The $1, that's about 100 shillings. And so strategically, I would imagine we can, as a country in the last couple of months, go to source, get these items, avail the PPE at costs that are sustainable. We ought not pay 10 times more, if we can get this anywhere in the world for cheaper. And so getting adequate PPEs shouldn't be an issue. We should get that within a fairly affordable rate and ensure this is given. At the same time, it's important to continue educating our population.
Right.
Because there's that laxity that comes in, that we imagine that because we've not had numbers, we are safe. That's not the case. COVID is continuing. We have to be careful, particularly for the vulnerable groups, to get them to a place of safety. Right now, when people talk about respiratory symptoms, difficulty breathing, from whatever reason, you have to think COVID first before you think about other possible diagnoses as well.
All right, Dr. Victor Ng'ani, a critical care doctor, as well as Dr. Evans Camuri, the Chief Executive Officer at the Kenyatta National Hospital. Thank you both for your time to have a conversation on Daybreak, of course, looking at the state of the pandemic in the country. Thank you, and we'll see you some other time. But again, to recap the breaking news this morning is that a former Member of Parliament for Likoni constituency, Masood Mohima, has died at the age of 78. He died in Mombasa at his Vimani home in Likoni sub-county, and he's said to have succumbed to asthma-related complications. That's the news that we are receiving this morning. We take a short break on Daybreak, but when we return, we'll be speaking to one Abdikadir Mohammed, who is the constitutional lawyer. He was the chairperson of the Constitution and Implementation Oversight Committee in Parliament until 2012. We'll also be speaking to Teresa Omondi Deitan, who is the Deputy Executive Director at FAWE, Moses Kajwang, who is the Senator of Homa Bay County. They'll be speaking to us, as well as Priscilla Nyokabi, who is Commissioner at the National Gender and Equality Commission. We'll be talking about Katiba at 10, looking at the strides that have been made in the judiciary, executive, as well as in as far as fighting for Chapter 6, the integrity chapter in the Constitution. We're back in a moment.